Good morning, ladies and gentlemen. Welcome to today's press conference. Hopefully everybody's preparing for the holidays. This will be the last time that we see everybody heading into the holiday period, so we definitely wish each and every one of you a happy holidays. We have a lot to cover today. We have multiple guests joining us to share some news as well as some overviews. So with that, I'll go ahead and kick it over to the boss, over to Secretary Denis McDonough.
Great. All right. Thanks a lot, everybody. It's really great to be here with you. Really appreciate the opportunity to check in with our valued colleagues in the press, both here in the building and virtually. We had, as we were getting ready for this month's press conference, we had planned to make sure that VBA was our guest today because VBA is doing amazing work, and just because of the crush of other business the last several months, our guests have been from other elements of the VA. I was really thrilled to learn this morning in preparation, in a timely way for today's presser, that yesterday marked the 9th time in fiscal 2025 that VBA has processed more than 11,000 claims in a day. So we have done that 11 times in our history, and 9 of those times have obviously been in this fiscal year. So I'm really thrilled by, appreciative of, admiring of the prompt way VBA is processing claims. Now it's not obviously uniform. There's still too many claims that end up having to wait longer than we would like, but we're going to make sure that we get to a veteran-centered answer before we rush to a no. So I thought it was fitting that the day that Josh and Kenesha were to join us for the presser, that we learned of another day of very high performance at VBA. So thanks to our VBA colleagues. Thanks for continuing to run a veteran-centered operation over there. So let me yield the floor to our first guest, the Undersecretary of Benefits, Josh Jacobs, and then he'll introduce our next guest, our valued teammate, Kenesha.
Thanks very much, Secretary McDonough, for the invitation to join you here today and for your continued leadership and dedication to the veterans, families, caregivers, and survivors that we are privileged to serve. Over the past 2 years, we've been delivering more benefits to more veterans more quickly than ever before in our nation's history. This success has been largely driven by the PACT Act, which expanded benefits for toxic exposed veterans and their loved ones, and through enhanced outreach efforts to ensure that veterans know about and can access the benefits that they've earned and deserve. Building on that momentum, we've continued enhancing many of the programs and services veterans and their families rely on. For example, we're making meaningful changes to our life insurance programs. We introduced the new VA life insurance program in 2023, which provides coverage up to $40,000 in whole life insurance to all veterans with service-connected disabilities, with no deadlines to apply up to the age of 80. And in the very near future, we are planning premium discounts for Service Members Group Life Insurance, SGLI, which insures more than 2 million service members. Due to the strong financial position of the program, we anticipate reducing premiums for service members from $30 to $25 per month for $500,000 in coverage, and being able to maintain the discount for the next 5 to 10 years, subject to the program experience and market conditions. We're also planning premium discounts for veterans and military spouses covered under the SGLI family of programs. These discounts are expected to take effect between April and July of 2025. In addition to improving the affordability and accessibility of our life insurance programs, We're also committed to addressing the unique and often deeply personal challenges faced by survivors of military sexual trauma. While there is still much more work to do, we've made important changes to provide better support for veterans who are MST survivors as they pursue their earned benefits. We recognize the immense courage and strength it takes for MST survivors to come forward and to file a disability compensation claim. And that's why we treat all claims, but especially those related to MST, with the utmost respect and seriousness they deserve. Over the past several years, VA has instituted a series of reform measures to improve the MST-related claims process for all MST survivors. These reforms were designed to improve trust, encourage more MST survivors to file a claim, and enable VA to deliver more benefits to MST survivors. Some of these reforms include the incorporation of trauma-informed communications principles and human-centered design into the MST claims process, the appointment of a single senior executive to oversee the MST workload, consolidation of all MST claims processing to a single operation center, which has been supplemented more recently by a surge site, and a memorandum of agreement with DoD that allows us unrestricted access to reports of military sexual assault. These efforts are having an impact on the lives of survivors. MST survivors are applying for their benefits at record rates. We're completing more MST claims than ever before, and we're able to grant these MST-related claims at a historically high level. While we're proud of the progress we've made, there's still much more work to do. The growing MST workload is driving the need for continued prioritization of MST claims, and we're working to improve the quality of our MST claims decisions. We're taking action so that every MST survivor knows that help is available now and they can receive the care and support that they deserve. And at this time, I'll turn it over to my colleague, Kenesha Britton, who will provide you with more details about the important work we're doing to support MST survivors.
Good morning. Thank you, Undersecretary Jacobs, and thank you, Secretary McDonough, for the opportunity to speak today. At VBA, we recognize the remarkable courage it takes for survivors of military sexual trauma to step forward and seek the benefits and support they've earned. Our mission is driven by a commitment to ensure survivors are met with care, dignity, and sensitivity throughout the claims process. Over the last several years, VBA has been working aggressively to better serve MST survivors, focusing on simplifying the claims process, improving timeliness, and the quality of MST claims. Over the last 14 months, we've completed an unprecedented amount of outreach with over 3,500 events dedicated solely to MST survivors to make them aware of the benefits available to them. Our efforts are paying off, not just in increased trust, but in tangible outcomes. In fiscal year 24 alone, VBA received more than 57,400 MST-related claims, an 18% increase in FY23. And as of November 2024, we've already received over 10,700 MST-related claims, a 23% increase compared to the same period last year. Since 2020, we've quadrupled the amount of completed claims, meaning more veterans are being served, opening doors to health care and other benefits and services. While the MST inventory has grown from 10,300 claims in FY20 to more than 36,000 claims in FY25, we've reduced the average days pending by over 16% since FY23. And it's not just about speed. The overall grant rate for MST-related claims rose to a combined 63.6% in FY24, up significantly from where we were in 2011 at 41%. Looking ahead, we're focused on further improving the veteran experience. In 2021, we completed the MST Journey Map to better understand the survivor's perspective and address pain points in the process. We will continue to apply trauma-informed principles, partnering with VHA clinical experts to ensure survivors are treated with care and sensitivity and working to reduce or eliminate re-traumatization while engaging with VBA. We also recognize the importance of getting claims right the first time. Recent enhancements to our quality assessment process, including expanding the sample sizes and more granular reviews, have been implemented to improve accuracy and outcomes. At the same time, we're building cultural competency amongst claims processors and prioritizing their well-being to ensure they are equipped to handle these sensitive and complex cases. Finally, we want every survivor to know that help is available now. You do not have to wait until your claim is decided to seek support. MST-related services are available to veterans and most formal service members, including those with other than honorable discharges. There is more work to do, but we are determined to make meaningful changes that continue to build trust and instill confidence for all MST survivors. Thank you for your time, and I'll turn it back over to Terrence.
Good job.
Thank you.
Thank you, Kenesha. With that, we'll open the floor to questions. Leo.
Thank you again for doing this. I wanted to follow up on what you just said, Ms. Britton, at the end there. I don't know if you guys can gauge how much of the increases you're seeing are related to outreach and how much of it's related to trust. Obviously with something like the burn pits and the PACT Act, it's more related to the outreach and the new benefits there. Is this a situation where it's just folks haven't reached out to these people, or these individuals are now seeing this as more a more viable path, or can you even gauge that?
Yeah, Leo, thanks thanks very much for the question. I'll start and then I'll turn it over to Kenesha. I think it's a combination of factors. One, Kenesha mentioned the significant amount of targeted outreach that we have engaged in that's specifically directed at trying to better reach MST survivors. Secretary gave us a goal, a very clear goal, of working to move VA and meet veterans in their lives rather than making them adjust to VA and our needs. And that is in part what we have been doing through the extensive outreach that is specifically targeted at MST. We also have seen, as a byproduct of the general outreach that we've done, more veterans coming in to apply for benefits. And that, I think, has to do with building trust, because we are actively trying to reach veterans, telling them, we want you to connect with your earned benefits. I saw that up when I was in rural Maine, and I met a Vietnam veteran who came to try VA for the very first time after decades. And we're also seeing that with MST survivors who are now coming and filing a claim for the first time. But let me ask Kenesha to build on that if she has anything to add.
The only thing that I will add is with the enormous amount of outreach that we've been doing, we've seen that consistently our workload has gone up across the board. So we've seen the increase in PAC claims. Consistently with that, we have about 41% of our MST workload that also have a PAC claim that's intertwined with it. So that definitely has an impact on that growth. Also, with the changes in the legislation to make it easier for veterans to come in, I believe that also has impacted that growth as well. When you look at the numbers over time, you can see based on the years, the different factors and the different things, particularly when the legislation was passed, we started to see our inventory start to increase. So it really started to increase around that time. And then again, when we established the 9,000 claims, and then a third time when that PACT legislation was released.
Okay, great. Thank you.
David, good morning. You there, David?
Hold on, Terrence, trying to get the camera going.
No worries, my man.
May have to do without it. Hold on. Oh, there we go. Well, should go. Good morning.
Good morning.
Secretary McDonough, if we can switch gears a little bit from the MST we're talking about.
Sure. Yep.
So I'm hoping to talk to Secretary McDonough there, Terrence.
Yeah, he's right here.
Right
Trust
here,
me, he hasn't left.
I see. Secretary McDonough, we have something like 7 weeks left in the administration, and I wondered if you could reflect a little bit on what you consider your biggest successes and maybe the the issues you feel you didn't get resolved.
Yeah, like David, I really appreciate the questions, and I think I make a good faith effort to reply to your all's questions down here. But I gotta tell you, I haven't really thought about this in terms of what I have done or, anything like that. So
How about what the department's accomplished during your time? Put it that way.
yeah, so okay, that's where I was just about to go. And then I want to just come back and just double tap one more time, or double click one more time on what Kenesha ended her comments, her opening comments with, which I think were really important. I think the most important thing that we've done in the course of the last 4 years is underscore to veterans that we work for them, that the programs are designed for them, that the care that is provided is their care, and the benefits that are delivered are their earned benefits. Josh just made reference to this, and we've talked about it a lot in this room. And frankly, our monthly press conferences are a part of this, where we have made a very concerted effort to reach veterans where they are so that they can be in a position to get the care and the benefits that they've earned, that they don't have to turn their life upside down to fit into our programming. This is, for example, why you've seen historic levels of access to community care each of the 4 years that we have been here in the building, because we want to make sure veterans get access to care where they are. And I was recently timing at a swim event, and I was timing with another parent who happened to be a Navy vet. And he talked about how for the longest time he did not apply for his benefits because he thought somebody else needed them more, or that somehow he was going to take them from somebody else. He now says that he's the biggest advocate to his fellow battle buddies to make sure that they get in to get their benefits. I'd like to think that that's a reflection both of his determination as a veteran looking out for his fellow vets, and it's a manifestation of the fact that veterans feel like we are more responsive to them. So that's what I'd say. Let me just double click, as I said, real quick on the concluding paragraph of Kenesha's remarks. I think she communicated very clearly to MST survivors that we, consistent with what I just answered how I just answered your question, David, we work for you. The benefits and the care that is here are yours, and we want to make sure that you know that care and those benefits are here. You should not suffer alone, and there is support for you that you have earned, and we want to make sure that you come in and get it. Thanks.
Secretary McDonough,
Yep.
a follow-up, if you don't
Yep.
mind. And Terrence knows this. My publication's all about the federal employees, the workforce.
Yes.
I wonder if you could talk about which maybe you've achieved on that front, how they've done for you, with you over the last 4 years, and having served in the previous administration, there's always more work to do. You feel like, there's things you wish you could have done before you get out the door. I wonder if you could talk about the workforce and anything you really you'll look back on and say, God, I wish we could have gotten that completed.
Yeah, well, look, 3 things. One, I opened with my comments about the fact that yesterday we processed more than 11,000 claims for the 9th time in this fiscal year. And by we, I mean VBA. And we've done that now 11 times in our history, meaning 9 of those 11 times have occurred just in this fiscal year, and the other 2 were late in the last fiscal year. So I'm very proud of the performance of our claims processing teams at VBA. 1. 2, We've talked about this in the course of the last several months to include in the course of the debate as we've asked for additional funding for VHA. We provided 131 million healthcare appointments last year, also a record. And we did that at a time when veteran satisfaction and veteran trust reached record highs at about 91.8% veteran trust for VA outpatient services. So I'm really proud of the workforce on that. Third, we've also grown the workforce in the last several years. And so not only, we've been able to grow that through a variety of means, most profoundly, the mission at VA. This is the best mission in the federal government. Secondly, we've been able to make investments using new VA, new tools for pay enhancements, which were a long time in coming at VA, where we are now even more competitive with other, for example, healthcare providers. Third, something that I wish we could get, that we could, have said is done and finished, is there are still veterans whom we have not reached. And we have not reached them because we can't get the right combination of outreach, but we also haven't reached them because maybe we failed them in the past, or maybe they just don't trust us because of what they've heard about us. So look, we go to bed every night here knowing that there's a lot of work yet to be done. That work, the trust work, is really important. I wish we could. I wish we can do more. I hope and I expect that we will do more, because there's 19 million vets, 18 million vets in the country, a little over 18 million vets in the country. We have relationships with just over half of them. We should have a relationship with every single one of them.
Terrence, last thing, I just want to say something unsolicited. Secretary McDonough and you and your staff have been unbelievable these last 4 years. And if every government department had outreach to the press the way you guys do, we'd have a much easier working relationship with the entire government. So thank you guys for all you've done.
Very nice. Thank you.
Thanks, Dave. Appreciate you. Patricia.
Thank you for doing this. I appreciate it. I have a couple questions. Secretary McDonough, over a year ago, you talked about doing a review of the hypertension claims. There was like 83% were zero under the PACT Act. Can we get an update? It's great to have you here under Secretary Jacobs. That'd be great.
If we can just go straight to Josh.
That'd be great.
Because he actually knows something.
Okay.
Yeah. Well, thanks very much for raising that question and concern. The issue that you're raising is that under the PACT Act, we now cover hypertension as a presumptive for Vietnam veterans. And we've seen a surge of those claims. One of the concerns that we've heard as we're working to deliver those earned benefits is that some veterans have been receiving a 0% service connection. That means that they are service connected for hypertension, but they don't receive compensation for it, albeit there are ways in which they can if it's combined. It does open the door for additional healthcare eligibility and enhanced services on the healthcare side. But the net impact among some veterans is a belief that they need to go off their medication to receive a higher disability rating. And we are actively communicating to veterans with hypertension to not do that. The question that you asked, though, is what are we doing here? And so we've developed an IPT to try to make it easier to, or we have developed an IPT with our cardiologist partners in the health system to identify opportunities to make some improvements there. There is active work in process. It is in the rulemaking process, so I'm somewhat limited in terms of what I can say, but those activities are underway.
Okay, so it's in the rulemaking process, but a preliminary proposed rule hasn't been published yet, right? Okay. Is there any movement afoot? VA has a pretty high threshold for what is high blood pressure that's actually very different than what is medically accepted. So is that being considered in that
That's
rule?
actively part of the effort that is underway, is to align it with the current medical understanding of blood pressure readings.
Any timeline on that?
I would have to get back to you on that. Yeah.
Okay. Second follow-up, another question, not related to hypertension. It's December, and we haven't seen the annual VA suicide report. So where is that, and what's the holdup?
Yeah, thanks very much. I want to go back on the hypertension point. That, you know, I think I don't know if it's the AMA or whoever manages the medical evidence on this has changed what's elevated, what's high blood pressure, just in the last year or so. So we are making sure that we catch up with that. Secondly, on suicide prevention report, I just had a meeting with this today. About this this morning, to express my strong feelings about the fact that this report should be public. And so I anticipate it'll be public in the very near term. In terms of, I think we've been communicating with you guys over the course of the last several months about the process by which, we get to the conclusion on this. And so I think we've given you updates on, some of the procedural hangups that we've encountered. But, this is important data. This is important data for the community. This is important data for our, meaning the community of veterans. This is important data for our partners like Congress and the VSOs. It's important data for epidemiologists and other experts who use that data every year to kind of help us, determine what works and what's most effective and what's least effective. So we want to get it out there, and I have every anticipation that it will be out there soon.
Okay, thank you very much.
We'll go to Quill. Good morning, Quill.
Can y'all hear me all right?
We can.
All right. I was going to throw a prank and not have any sound just for old time's sake, but nice to see everybody, and thank you as ever for
That was what, 21, 22, and 23 that happened?
I don't know if it bled into 24, but I'm glad to be remembered for something.
Yes.
So before I jump into a couple questions I have on VASP, and I don't know if you'll have numbers on this, but with pardons in the news, I was wondering, you mentioned being able to grant VA benefits, being able to change sort of status, eligibility for VA benefits to MST survivors who have bad paper. And the White House had reiterated today that back in June it pardoned anyone who had been put out of the military for homosexual conduct. I'm just wondering if you've got visibility on how much that brings people in to apply to VA for benefits, and how often you are recharacterizing service of vets who have bad paper. And I'll understand if you don't have that number to hand, but I'd be interested if you do.
Yeah, I think it's an interesting question, and we've gotten preliminary updates on that, and I think we could get those put together and get those to you, Quill, and maybe we can even do like a bigger look at this, and maybe get it to you next month too.
That'd be great.
But I think it's an excellent question. We are prosecuting that data. We have the same question ourselves. And so, because we are now, the White House effort on the pardons is one source of that data. The other source of data is characterizations of discharge, reviews of characterization of discharge since we announced the new process by which we will determine eligibility for those with other than honorable discharges. So that's another source of that data. Let us aggregate that and get it to you guys.
Wonderful. Thanks so much. And then with apologies, I've got more questions about VASP. In our most previous correspondence, we mentioned that there are 1,300 veterans who had a 50% increase in their monthly payment. Our last correspondence was that VA was saying it couldn't do anything to help them. It didn't have the authority to help them. I'm wondering if you've asked Congress for that authority, if you intend to try to get that authority. I mean, these are just by our count, 1,300 vets who, because of the VA error, end up with a huge increase in their monthly payments. And I'm just wondering what you're able to do to help them.
Good. Quill, thanks very much for that question, and thanks for your continued focus on housing for veterans. I would start by saying that since March of 2020, we've been able to help more than 750,000 veterans avoid foreclosure, and nearly 90% of all veterans who completed a loan modification during the pandemic received an interest rate lower than their original rate. Now, you've identified a group of veterans who fall outside of that 90%, and what we would say to those veterans is that we encourage them to work with their servicer, contact VA, talk to a VA loan technician to explore their options. Each of those situations is different, involving different circumstances. We're actively engaging with our congressional partners in discussions about a variety of different programs and different opportunities. We have the ability to work with them through the entire waterfall of options to help them retain their homes, including things like repayment plans, loan deferments, and much more.
Right. We've had this correspondence, and I think, as you know, these are veterans who their rate didn't go down because the economy changed and rates doubled on everybody. And it's a relatively small number of veterans we're talking about here, who, again, because of a VA error that you guys have acknowledged and are taking responsibility for, they're in a very tight spot, and nothing in that waterfall is apparently going to help them. I'm just wondering what specifically you could do. You could turn PCP back on, or could you just categorize them? The experts we've talked to in the mortgage industry think that the VA does have the authority to do this.
Well, I'm happy to talk to the experts that you're referring to. We've had extensive conversations exploring our options. And as I mentioned before, we've been able to keep 750,000 veterans in their homes since 2020. We're actively engaged. We have regular conversations with our servicers who provide the loans that we guarantee. We talk regularly with housing advocates, and we work with our interagency partners to actively explore all potential opportunities to do everything in our power to keep veterans in their homes and to expand the opportunity for home ownership. But we're also making sure that we're monitoring our implementation. So if you've got information that I don't have about those potential opportunities, I'm happy to have that conversation.
Is that 1,300 number, by the way, does that make sense to you? I've asked this several times by email. Do you have a different estimate for the number of people who had a drastic increase in their
I don't have those numbers off the top of my head, but I'm happy to take a look.
Okay, great. I'll let other people ask other topics, and I think my colleague will have a couple more questions about VASP going forward into the next administration.
Thanks, Will. We'll circle back.
Thank you.
Jordan.
Hi, Hi, thanks again for doing this.
Good morning.
I wanted to ask about the upcoming December 20th funding deadline. I know, of course, VA is in a different situation than other agencies when it comes to matters of government shutdowns or CRs or things of that nature. But what impact, if any, is the VA anticipating if there is perhaps a government shutdown, or if Congress does get a CR or a continuing resolution over the finish line, what that would mean for VA, especially given its budget shortfall situation?
Yeah. Jerry, thanks so much for the question. And so I think what I'd say is that, let me just segregate the question. First, I'd say that, we have protocols here internally to make sure that as we approach a CR date, that we get the relevant personnel from across the enterprise together to do prudent planning. So that work is ongoing. They just had, I think, their most recent meeting yesterday. So I don't have like a readout of that process on any specifics that we're focused on, but I can tell you that that team, which is now very experienced, is meeting on a regular basis, planning for eventualities if Congress doesn't extend the CR by the 20th, or come up with an omnibus appropriations act or something. So that planning's ongoing. I don't have a readout of that. It is true that we have requested $6.6 billion in additional funding for the rest of this fiscal year for VHA. We need that funding because we are delivering more care, more benefits to more vets more quickly, as Josh said, than ever before. And so, with that funding, we'll be able to hire clinicians, replace aging medical equipment, purchase necessary medications and prosthetics for veterans, and most importantly, maintain the high quality health care that the veterans have come to expect and surely richly deserve. So, we're answering questions to Congress on this issue. We've had testimony in 2 different hearings in the House in the course of the last 4 weeks or so, and we're going to keep working on this to make sure that we can get that funding.
Mm-hmm. And until that $6.6 billion gets addressed one way or another, what's the VA's hiring picture look like? Is it in this still kind of constrained hiring environment that it's been in for much of this fiscal year? What does that look like until Congress addresses that?
Yeah, rather than add new facts or new analysis to this question, let us get you what we've said on this, particularly because I may not have the most up-to-date assessment from our VHA colleagues. So let us take that and get that answer from VHA. I do know that one of the things we're concerned about is, over the course of the last year or so, we have been delaying certain technology purchases and equipment purchases so as to, not compromise other funding needs. So that would be one of the things we're particularly focused on, as I listed that series of investment priorities just a couple of sentences ago. But in terms of hiring, let us get you a very specific answer on that.
Okay. And then finally, I wanted to get your thoughts on, with the incoming Congress, the House and Senate VA leadership have been pretty clear that they want to make the VA to make full use of the VA Accountability and Whistleblower Protection Act. You've told us before, about a year or so ago, that the VA is not using authorities in that legislation to fast track the firing of VA employees who've been accused of misconduct or poor performance. You've said that language really was getting the VA more in front of federal courts and losing in those cases more than doing anything productive on the accountability front. Just as that incoming Congress is coming in here, what's your message to them when it comes to this whole policy area?
Yeah, you know, when the incoming Congress comes in, if they ask me questions, I'll give them messages. That I don't need to communicate messages to them through you guys as much as I love you and appreciate you guys. So let me not, you know, suggest that before these people are even sworn in that I'm somehow sending them a message. I look forward to, for the couple of weeks that I'm here, while they're here, I look very much forward to working with them. I do notice that there's a lot of veterans in that group, and I think, as I've said in this room before, you know, I get to travel the country in this job, and every place I see something interesting happening, inevitably there are veterans involved in that. That's definitely the case in Congress as well. Now, I will just give you my thoughts about the various authorities that we have here. First and foremost, as an HRO, for example, at VHA, the Veterans Health Administration, a high reliability organization, we obsess about failure. We learn everything we can about failure. We empower our clinicians to make decisions at the point of care, informed by their expertise, not informed by somebody telling them what is the optimal investment. So we want our clinicians to feel so empowered. In exchange, we expect accountability for those actions. And when our providers do not live up to that accountability, those accountability requirements, we hold them accountable. We hold them to them. And we've talked about in this room a series of examples of us doing that. Detroit is a good example of that. Denver, Aurora is another good example of that. Those are just two examples in the last year where we, using our existing authorities, have moved with dispatch to change and improve situations where veterans were not getting the care that they deserve. Next paragraph. It is true also that there are additional authorities that Congress has enacted that when VA has tried to use them in the last 5 years, we end up more before federal magistrates and judges than in individual conversations with our providers and holding them to account. I'd much prefer us to be able to just manage our building rather than spend so much time before judges. And so that's what we've tried to do here. The fact that we're providing more care, more benefits to more veterans more quickly than ever is evidence that that's working. It's not perfect in VA. Last thing, we also take very seriously our responsibilities to go to Congress to inform them of instances where we are not performing to our highest not performing to our expectations. And we routinely do that. And you guys are very familiar with all the times that we've done that. I'm sure even just this week. And so we take very seriously the congressional role, the role that the founders envisioned for the Article 1 members of this government. And I hope that, you know, that continues here, right? Because I think Congress is an important partner. You know, I think any fair assessment will tell you that we have been very forthcoming with Congress. And I'm proud of that fact.
All right, thank you.
We'll go to Chris. Good morning, Chris.
There, can you guys hear me?
We can. How are
Radio
you?
guys in our audio. Thanks, Terrence. I just have two questions about VASP. One is pretty simple. How is the VASP rollout going so far? Just anecdotally, the vets who we've been in contact with, very few of them have been able to get into a actual VASP mod or new loan through VASP. and the moratorium deadline, I think the end date on it is the end of the month. Are you considering extending the moratorium to give people more time, or what happens on January 1 to all the folks who haven't been able to get that sorted out?
Great. Well, Chris, thanks very much for that question. Right now, we have approximately 90% of VA home loans that are held by servicers who are participating in the VASP program. And to date, we've received approximately 6,500 applications for VASP, and we've certified more than 4,900 of them. And so the large proportion of those VASP submissions are being approved. Some are still pending review and undergoing that process. And we're continuing to work with servicers to make sure that they understand and are implementing the program appropriately. And I think one of the important points to keep in mind is that we work through a loan retention waterfall. So to the extent that other options to keep veterans in their home may work, we will work to pursue those before we get to VASP, which is a last option to keep veterans in their home when nothing else works. With respect to the foreclosure moratorium, I mentioned earlier to Quill that we have been able to keep more than 750,000 veterans in their homes since March of 2020. And in that time, for 52 of the 56 months, we've had a foreclosure moratorium in place. In the end of May, we provided an announcement encouraging servicers to implement a targeted foreclosure moratorium through the end of December. And that was designed to give servicers the opportunity to implement the VASP program. I mentioned it's approximately 90% of servicers, about 90% of the VA home loans are covered by servicers who are participating in that program. And so as we look towards the end of the month, we feel pretty good about the implementation of the VASP program. We've had high utilization from those submissions, and we encourage veterans to continue to explore opportunities with their servicer if they're experiencing financial hardship, and if they need assistance, to contact us directly to talk to a loan technician. That number is 877-827-3702. So we're anticipating the targeted foreclosure moratorium to expire at the end of the month, and we want veterans to know that we're here to help if they need assistance.
Okay, and just when we first started reporting on this, there were 40,000 vets facing foreclosure according to industry data. So 6,000 is only 15% of those people, and interest rates are still at 7%. The other loan mod options, double people's or raise their payments massively. So it doesn't look, it looks like only a small portion of folks have gotten VASP. So, we're just concerned, obviously, like keeping an eye on, are people going to get the help in time?
Yeah.
And my other question is, with the 1,300 we identified, and we get it. There's 700,000 people got help. Like, hats off. We're not at the same time, we've identified for you guys, like, hey, look, in your own data, there's 1,300 vets who really got hurt here financially. Their payments rose massively, like more than 50% every month. And I understand the answer is often, well, they should reach out to us. Why put the burden on these veterans to raise their hand again and ask for help from a system that has failed them? Why not, we don't know who they are. Like, we can't see the personal identification to identify them in the data, but you guys can. Why not reach out and say, hey, look, this seems like it didn't work out right for you. Do you need help? What's going on? Have you thought about that?
We're actively exploring all opportunities. I'd have to go back and talk to my loan guarantee to talk about the specific outreach that they've done. But every day we talk to veterans who are seeking assistance. We explore all of the opportunities, and we're doing everything in our power to make sure that veterans can stay in their homes. And so the programs that you referred to expired, that largely, the partial claims program, that expired largely because we were relying on emergency authority and resources tied to the pandemic. But we have designed a program that we think will help as a last-ditch effort to keep veterans in their homes. And what we've also seen is that the other loss mitigation programs that exist have seen significant increase. So we've been able to refinance a number. We've seen, I think, something in the order of a 1,500% increase in interest reduction rate refinances for vets. I'll have to go back and confirm that number just to make sure, but significant increases in utilization of existing authorities, and then the VASP program obviously helping as a backstop when all other opportunities exist. So we'll continue working as we always have. Each case is different, each loan is different, and our commitment to veterans, the veterans that we serve, is to work with them individually to do everything in our power to help them stay in their homes.
Okay, and I'll let you ask other folks ask questions, so we're not, asking too many vast questions here.
Any additional questions in the room? Jordan.
Hello, thanks for doing this. I had a question about the EHR program. I know we've talked about it throughout the year, but thinking about as we get to the end of the year and eventually end of the administration, how are you working with the presidential transition team to prepare and eventually hand off the program?
Yeah, so we don't have any new news about the transition team. So when the team gets here, we'll make sure that we make that public, and this will be among the things that we're going to want to talk to that team about. So we don't have any updates on how we're talking to the next team about the EHR.
Well, let me ask, how are you preparing for it? Going into next year then?
Well, we've been working in the context of the reset to make sure that we're in a position to learn everything that we possibly can about the performance of the system and the upgrades of the system. We're making sure that, since the go live in March 2024 in Chicago, that we've been pleased with the progress of the EHR system at the Lovell joint facility that we run with the United States Navy. It's obviously still too early to declare final or unequivocal success. There have been some promising results. Importantly, I think across each of the EHR systems, we've seen increased veteran trust since the EHR go lives. We've seen decreased wait times. We've seen dramatically decreasing disruptions in patient care since January 2024. We're seeing decreasing numbers of interruptions for clinicians, therefore minimizing the slowdowns for veterans. We're seeing an increased clinician and staff satisfaction, but there's still, I just want to underscore, as I will with each of these generally, but let me specifically say here, there's still room to improve there, dramatic room to improve, but we're seeing increased clinician and staff satisfaction. And we do feel like the EHR launch in Chicago was a success. This all adds up to the thing that we care about most, which is better care for vets that we serve and a better experience for the clinicians who serve them. So we'll be sharing all of those findings with the transition team. But remember that there's a relatively small number of political appointees here at VA. So the overwhelming majority of VA professionals who work on EHRM will be working on EHRM on January 21st, just as they were on January 19th. So that team stays, and we've benefited greatly from our opportunity to work with them. And I say our by that I mean those of us who are political appointees. So that work, the reset work continues. We feel good about it. There's still a lot of work to be done. We'll make sure that the transition team has a really good understanding of that. But in all cases, also the team that works, this is a team that's going to be here, is here now, and will be here deep into the next administration.
Thank you.
Leo.
Yeah, just two quick questions. I wanted to ask you about all the private conversations you're having, if you'll give us all the details. But in seriousness, last time we were here, they still hadn't, the new administration hadn't signed the memorandums needed for the transition work to start. So is that in full effect at this point? Are you working with the next administration, having conversations that need to have so that there is a seamless transition at this point? Or are we still waiting for the Trump administration to finalize some of those details?
I think that's a better question for the White House, and we'll help facilitate you getting that question to the White House.
Okay.
Because the key, the on and off key, is held by the White House and the transition team. So to be honest with you, I think I could go from memory, but why don't we just get you the answer from the people who are in charge of the keys?
Okay.
Okay.
And then jumping back to the number of claims that have been processed, and you both mentioned that 11,000 number. The claims backlog has sort of plateaued over the last few months, though. We have talked about this a bunch of times, and I think 2025 was when you thought that we'd be getting back to the pre-pandemic levels. Are we still looking at that kind of timeline here, or is it getting pushed back by some of the PACT Act claims, some of the increased volume that we've seen over the last year?
We're actively reevaluating our projections right now based on the latest actuals and the trends that we're seeing, both in terms of the number of claims we are receiving, historically high levels, and continuing to see robust submissions based on historic levels of outreach, as well as our production capacity. So we're going to work to revalidate that. We're mindful, right? If backlog is the only metric of success in this organization, we wouldn't do things like conduct the largest outreach campaign in VA history. So it is one very important metric, but it is not the only metric. We're also looking at the total number of veterans that we can serve. We're looking at the accuracy, and importantly, we're looking at the experience, trying to make the experience of applying for and receiving benefits optimized so that we can encourage more veterans to do it, and we can make it easier to do so.
Understood with that. However, if you're not moving that down, does it point to pulling in too much work for you and too much for the current workforce? Is there a concern that seeing that number starting to flatten out instead of the drop that it had been on is pointing towards either the need for more staff or the need for just a different way to do things?
Well, we're always looking at ways to improve the way that we do business, and we're always looking to serve more veterans. And so one of the ways that we've worked to improve the way we do business is by implementing initiatives like the Overdevelopment Reduction Task Force, where we're trying to reduce unnecessary medical exams that take additional time and money and require veterans to go oftentimes long distances. We're implementing new automation tools to enable our workforce to deliver timelier, higher accuracy decisions. So we're looking through all of that, and we're ultimately going to make a decision based on the data that, again, we're working to revalidate right now with the updated projections.
Okay. All right. Thank you.
Sure.
Back to you, Chris.
Oh, sorry, guys. I just had my hand up by accident. Although, why not? I'll ask one more. Just so I wasn't clear on the answer of like, would you guys consider proactively reaching out? I mean, now that we've been like, hey, look, 1,300 people, payments went up massively. We have no way to contact them to say, hey, VA wants you to reach out if this is like killing you.
Yeah, well, like I think the way Josh answered that question, Chris, was to say he's going to check with his team. He's under the impression, as am I, that we are reaching out to veterans regularly. We have a lot of, one of the things we do well, among the things we do well at VA is homelessness prevention. That was a big priority for us year before last. Because of the prevalence of data we have, we can sometimes identify a veteran who is encountering challenges. And we do preemptively, not preemptively, proactively, thank you. I knew it started with a P and an R. Reach out to veterans who we assess may be encountering challenges. And so it's not that we would consider it, it's that we do it. And I think we'll come back to you with the the most helpful description of what we're doing and how we're doing it and why we're doing it.
All right, thanks, Secretary McDonough. And I'll circle back on the 1,500% increase in IRR mods is interesting. I didn't know about that too. So
and I'll work to verify that number. It's that's my recollection, but I'll just make sure to confirm that if it's different to get you that number.
Let me just explain to you what happened there, because Josh used that number and he thought to himself, I think I remember that number, and it's a great number, but then he's like, uh-oh, I hope it's the accurate number. So what he's saying to you is we're going to double check. He's going to double check that, but I've heard the same thing sticks in my mind, so we'll get you the 100% most accurate version of that and get it back to you. Patricia has a question.
Yes, sir.
Are you okay if I call on her?
Hey, you do. Hey. Are you firing me, sir?
Come on. Here you go.
My mom only watches these to see if I haven't gotten fired yet. So.
Well, Gary's mom watches to see if I'm gaining weight.
Patricia.
Well, I hate to sound like we're like asking you about everything at the end of the year, but can we talk about the infrastructure review? The commission that was canned, and then you were going to go back and look. What's the status of that review? Are you going to get that done before the end of your tenure here?
Yeah, I mean, let me just say some things, and then let's determine how I can be helpful on the question, because when you say, will you get that done, I'm not sure whether that is. And so let me explain to you kind of what the authority is, and then what we're doing, and then what I think you should expect. So the authority of the commission that you talked about is called the Air Commission. I'm not sure what A and I and R stand for, to be honest with you. But the Air Commission was enacted by Congress in the middle of the last administration. And it set up a process by which we divvied up the country into a series of markets. And we did an assessment of each of those markets of, most importantly, what do we think the veteran need is in that market? And importantly, what do we think the veteran need will be prospectively out in a number of years? That's the kind of the baseline analysis. Overlaying on that is an analysis of what are the existing VA facilities, what are the existing private facilities, how do those two kinds of facilities work together to meet that baseline assessment of what veterans are going to need in the out years. And then the last piece of that is, okay, in light of all that analysis, what should our infrastructure planning project look like, so that we're in a position to meet that veteran need. And that process was set up in large measure to also be able to factor in into that analysis that there are VA facilities in many of these markets that are aged or aging. And so we wanted to have a basis for which to make a determination as to whether those aging facilities should be updated or replaced with something else. So we did that whole project in March 2022. We put it out there. We are hoping that Congress would then, appoint the commissioners, so those commissioners would look at our plan and either give it thumbs up or give it thumbs down. the whole plan in toto. And then that would serve as the basis for our planning going forward. Congress decided not to do that because there were some things in there that they were not comfortable with. The same law that created that whole process requires us to do that baseline assessment, veteran need by market, overlain with provider capacity, VA, and private sector in that same market. Requires us to do that every 4 years. That is the process that we're engaged in right now. I don't know what the timeline is, and we can get you, Patricia, what the timeline is for the completion of this next version, the next quadrennial review of that, to give that analytic basis. So I'm fairly certain that will not be done by the time I leave. But that work is not tied to me. That work is tied to the statute. Last thing I'll say about this. I think you're also aware of the fact that we are aggressively looking at all, we are aggressively using all of our authorities to do as much infrastructure development as we can. And I think this is, and I think probably every VA secretary would say that. I think a thing that is new is that we have worked aggressively with our federal partners, most profoundly DOD, but also USDA, to make sure that where there is infrastructure available in those markets where we have veterans who have access needs, and that even if that's not VA infrastructure, but it's DOD infrastructure or USDA infrastructure, we go and access that and we begin providing care out of those facilities. And so that work is ongoing, and we'll make sure that we give you an update on that before we leave. But that's kind of extra the Air Commission process. Now, I'll stop, and you tell me if that's actually responsive to what you asked, or is there something else I was supposed to?
It is. Part of the foundational sort of charge of the commission was to identify buildings that were obsolete, real estate that was obsolete, that
Yes.
you all still have on your budget, sucks up a lot of money and they're just not being used, or it's just random real estate.
Correct.
Have you been able to shed any of that since the Congress scuttled the commission report? And,
No, I mean, the verbs in your question, scuttle and shed. And, I mean, it's like you have strong
I've been
feelings
doing
about
too
this.
many crossword puzzles recently.
Yeah.
Anyway, have you been able to get rid of some of this burdenous real estate that was a major complaint when you first came into office?
Yeah, it's still a major complaint, right? I mean, let's just take New Hampshire. You know, the facility in New Hampshire, there's really, really cold winter year before last. Gets really cold, pipes freeze, pipes burst. We ended up having to shut down. It's not even a hospital. It's an outpatient. It's a major, multi-specialty kind of outpatient facility, but it's an outpatient facility. We had to really curtail access there, and that is a version of the kinds of challenges we face. So we continue to face those challenges. Have we been able to close certain facilities? You know, one on the list is a facility in South Dakota in Hot Springs. That facility is still open. Our plan would have us replace that facility with a multi-specialty community-based outpatient clinic that would allow us to see dramatically more veterans in that facility, in that geography, than the existing more than 100-year-old facility. We've not been able to make that effort. Nevertheless, we are still continuing to make investments in South Dakota, including in Rapid City proper, as well as new community-based outpatient clinics in other rural settings in South Dakota. So all that process continues. But in that instance, the Hot Springs facility, Congress has made very clear that they have expectations on that.
Okay, thank you.
Yeah.
I think we got one last question. Back to you, Quill.
Hey, thanks. I mean, since we're waxing philosophical about the Mission Act, I was wanting to know, with the course of that over your tenure here, coming out of the pandemic, where the community care part was, I guess, thrown a statistical curveball there. How do you feel VA is in terms of its use of community care? Do you think you found the sweet spot? Do you think it needs to change? Obviously, there are people who are claiming that that would be a way to cut VA budget, would be to lean more on the community. I just wanted to give you a chance to talk about that big picture, please.
Well, you want me to talk about my feelings? Leo
And your
wanted
legacy, please. Will you just please talk about your legacy?
Yeah, that will happen exactly never. Leo wanted me to talk about all my private conversations.
You gave to Leo, anyway.
So that's good. So let me just establish three things. One, I won't talk about my private conversations. Two, I'm not talking about my feelings. And three, if you ask me, am I concerned about something? The answer is always yes. On community care, kind of how we think about this is, in the first instance, not that interesting, right? In as much as the statute has requirements, we follow the statute, and you know, we're a country of laws, so I don't want to suggest that there's something more important than the laws, but veteran satisfaction is exceedingly important to how we provide care at VA. It is the most current, the most up-to-date, I guess, that's the same as current. It's the most up-to-date assessment we can get about a veteran's belief about what's happening in the system. And right now, on outpatient care, we're at 91.8% in the system. So that tells me that veterans, in large measure, feel good about what's happening. You know, there's a remarkable story, or just collection of bullets. I don't think they write stories, by one of the news agencies last week about their belief, their aggregation of Americans' views of their health care access. And this is civilians. And the civilians' views as compared, no, it's not apples to apples, right? They're different measurements, but they're nowhere near 91.8% veteran satisfaction in the civilian sector, right? So that 91.8 is a really important thing for us. Also important are health outcomes. And, you know, we do a lot of long-term data analysis in the health side. We feel really good about what veteran access and veteran care in the direct care system means for veteran outcomes. And so those, I guess, if you were to say to me, you know, how do you feel about community care? I would use those things to answer any question about healthcare as the kind of the guiding lights, which is, I feel good, but there's inevitably more, no, not but, and there's inevitably more work to be done. Last point. There is, though, a big question for the country to resolve, which is, what do we want this system to be able to do? And that, you know, I get the sense that that's a debate that, you know, will continue to move along here. But we should just be really clear with veterans and with the taxpayers about what we mean by that when we do it. I think it would be a shame to lose the strength of this VA system, given all the data I just talked to you about, in terms of what it does for veterans, and importantly, for what it does for every other American. We saw that very profoundly in the context of the pandemic, where our providers cared for, kept alive civilians who would not have had access to health care otherwise, and VA innovations on care, VA research about care, routinely impacts outcomes for veterans as well as non-veterans. So, you know, if we want to move away from a system that, you know, has 400,000 VHA professionals, you know, a system that, you know, 75% of healthcare providers in the country have some of their doctors in the country have some of their training in a VA system. If we're going to move away from that, let's make sure that we're leveling with the American people on that, and make sure that we have a system to make up for the roles that VA plays. I think that would be a shame.
Great. Thank you. Thank you, Terrence. Hope we'll get a chance to have one more of these monthly pressers, or if not, maybe another holiday mixer. Since the other one was really Thanksgiving, we should.
Yeah, we will. We you know,
Okay.
we're not done yet. We'll, you know, so we're
All
going
right.
to circle back for January as we always have. So be on the lookout for that. We will have another press conference without question.
Great. Thank you so much.
Thank you, my friend. So I think that concludes the press conference. Thanks for joining
Happy
us.
holidays, guys.
And go Army, beat Navy.